My name is Tom Carroll. As a retired Sioux City pathologist and medical examiner, I know that comprehensive access to health care is vital for people with serious medical issues. Lawmakers say they want to protect patients with pre-existing conditions, but many of the proposed plans have financial caps or don't cover medical services or drugs needed by these patients. Cancer patients and survivors cannot go back to the days of the ACA, when insurers would not pay above a certain amount or charged outrageous premiums that were many times higher than a healthy person would pay. What would you do to make your people with existing conditions, like cancer, will have access to the coverage they need at a price that they can afford?
Thanks for the question. I'm going to sign into law Medicare for America. This is going to guarantee universal, high-quality coverage and care for every single American without exception. Those who are currently uninsured and uncared for are going to be able to enroll in Medicare immediately. Those who, as you referred to, are insufficiently covered, cannot meet that copay, afford the premium, or bridge the deductible, they're also able to elect to move into Medicare. But for those who have private employer-sponsored insurance, or members of unions who have fought for health care plans, sometimes in lieu of wage increases or other earned benefits, and have a health care plan that they like because it works for them and their families, they'll be able to keep that. So we get to universal guaranteed care while still preserving choice, and we avoid the false choice between the status quo, what we have today, the Affordable Care Act, and something that would force tens of millions of Americans off of private insurance and towards Medicare. And the out-of-pocket costs are going to be capped at no more than $5,000 for every American. Lower income and middle income Americans will pay nothing in most instances. No deductibles for any American, including on employer-sponsored and private insurance. So we make this far more affordable and ensure that far more of our fellow Americans can be well enough to live to their full potential. Thanks for asking the question. Appreciate it.